We're all gearing up here in Washington for son of Fiscal Cliff, which is going to be coming in a couple of weeks. And with that looming, we're beginning to hear the usual refrain about how important it is to cut Medicare benefits and to limit access to Medicare for seniors, and that's the responsible thing to do to save money, which of course is a preposterous and ill-informed idea, particularly in the context of a health care system that is 100 times more expensive than it was in 1960. And if you look at the graph, it's an accelerating curve of upward cost. And when you look at a $2.7 trillion annual expenditure on health care, that is probably 50% higher. But there's a 50% inefficiency penalty that we pay in the United States compared to all of our industrialized competitors. The worst industrialized competitor is 12% of GDP. We're at 18% of GDP. It's $800 billion a year spent unnecessarily. You look at the scope of this, you look at the accelerating, rocketing pace of the increase, and you think you're going to solve that by cutting Medicare? It's simply not right. As the CEO of Kaiser Permanente, George Halverson, said, that is an inept way of thinking about health care. He said, it's not just wrong, it's so wrong it's almost criminal. So hearings like this that point out that there really is a problem with cost and with the delivery system in the United States, and that we really have to address that problem if we're not going to misdiagnose what we have. And once, of course, you know you have a misdiagnosis, you usually don't get the right cure either. So it's really important that we not throw seniors and Medicare under the bus, because we have failed to address the real problem in health care, which is wild inefficiencies and rocketing costs that aren't just in Medicare. Indeed, Medicare is probably the most efficient deliverer of health care in our health care system. But if we